So I don't have a problem with any of this. I'm a 46-year-old sickle cell patient. I know that when I go to the ER, if it is under 2/70, broken, bleeding, not breathing, in labor, or there is some form of brain damage happening, that obviously is going to be taking priority over me and my pain. Okay, so let's be clear. This woman is not being dragged or attacked or piled up on because she is talking about the prioritization of patients in ER. That's number one. Number two, you said that you did not see the video, or rather, this video I am responding to is not. You did not see the video that is circulating amongst the sickle cell advocates and patients on this platform, in which this self-appointed educator, influencer, someone who has been nursing for less than 5 years, does say that pain medication is not the treatment of a vaso-occlusive crisis. That hydration should be given as treatment, not pain medication. Now, those aren't the exact words, because I know how you like to come back with the exact words. No, those are not the exact words, but it's close enough. She says you will not die from pain. The vaso-occlusive crisis is not going to kill you, and that pain management is not as important as hydration. Now, let's just keep it 100. As an ER doctor and somebody who claims to be a champion of pain patients and treating people in pain, giving them the best care that you possibly can, you already know that sickle cell is the most misunderstood, the patients are the most mistreated, disrespected, disregarded, and discriminated against patient population in the country. And next to HIV and AIDS in the early 80s, there is no other illness in which the anger and the hate and disgust for the disease itself, for whatever reason, gets directly translated over to the patient. And I am not in any way saying that this is something that you do or this is something that this young woman does. I am saying that that is our unfortunate reality, and that for 46 years, I have lived it. As a fifth generation sickle cell patient, I have seen other patients in my family live it, and as an advocate, I have advocated for patients who have dealt with just that, just inner, just dislike for our illness, and unfortunately us. So understand that when she made the comment that she made, the reason that she's getting the pushback that she's getting is because rather than just apologizing and saying I was wrong, I should not have said that, rather than acknowledging the fact that sickle cell is so misunderstood, that the patients are so mistreated and disrespected, rather than acknowledging the fact that out of 3 to 4 years of advanced schooling and hundreds and thousands of dollars of debt and countless hours, that you all are in no way educated nor trained about sickle cell, the disease, let alone the patient culture that comes with it. But you are warned, and that warning is acceptable in just about every hospital, every clinic across the country, especially when you get to adult care. And I cannot tell you how incredibly disappointing, upsetting, and hurtful it is as a patient to know that this culture of cruelty that has been allowed to be cultivated and fester amongst the medical community for the last century when it comes to this illness. It's blatant treachery. It truly is blatant, because the fact that medicine is supposed to be built upon trust, it's supposed to be built upon the highest of ethical and moral standards, in that I, as a patient, should walk into any ER and be able to trust that the doctor that pulls my chart is going to treat me to the best of their education and ability. And I know that 10 times out of 9, that's not going to be the case. Because as much as you all will sit and say, sickle cell is so painful, oh my God, it's so horrible, you will then turn around in an orientation or during your first job or residency and be told, but the patients are liars. The patients aren't trustworthy. The patients are difficult. Don't believe anything they say. They're just drug seekers. And it happens all day, every day. We are ignored. We are labeled. We are disrespected. And we are medically neglected and ignored. So, for this young woman to say what she said was bad enough, but for her to then double and triple down on the misinformation, on her message, is just adding to the century of horrible treatment that we've already endured. And the messed up part about it is that, unlike those that came before her, she has access. She has access to the patients. She has access to the information. She has access to people all over the world willing to educate her. And she's not asking for it. So I'm going to start her right here. Amazon, 127. Go get it. It's wrong.